Good morning, and this truly Dolphy Gilpin coming to you from 1524 Lavista Drive, Decatur, Georgia, United States of America. And we are continuing with our microanatomy, microbiology, and we have reached the treatment of osteogenesis imperfecta. And we have abbreviated it OI as osteogenesis imperfecta. And in all the previous lectures, we describe it now as a group of disorder of the bone cells and bone marrow, and that there were 4 types. But for details of that, you have to go to those lectures. We're on the treatment, and we say that the treatment of osteogenesis imperfecta is done by managing the symptoms. And in managing the symptoms, we can minimize the fractures. 2, we enhance independent functions. 3, reduce the pain. And 4, we promote general health. So we are managing the symptom of osteogenesis imperfecta. It is a group of disorder, and it is genetic related, with some defect in the genes of collagen COL1A1 and 1A2. So I've reached now the treatment of the musculoskeletal aspect of osteogenesis. And we said now you could go to physical therapy, fracture care, orthopedic surgery, and we apply medication to strengthen the bones, and we use mobility equipment. Okay, we will briefly return back to the AMZ5X12MIPCA in a moment, but let's just continue. As we move on to our pediatric treatment of osteogenesis, and we say that the U.S. Food and Drug Administration approved now the bisphosphonate or parmejonate to treat this osteogenesis imperfecta. But let us note that there's no universal treatment for this osteogenesis imperfecta, even though the Food and Drug Administration has U.S. Food and Drug Administration has approved this drug intravenously IV by bisphosphonate, that no established universal treatment is yet to be solidified. So we hear now that another name is zoledronate or Ricalis R. And that also in this pediatric treatment, we sometimes use supplement, vitamin D or calcium as needed. Surgery. Well, in surgery, we use surgery to correct the bowing of long bones in the OI patients, and this may involve osteotomies. Also, we use what is called intermedullary rodding surgery. Intermedullary rodding surgery to help to heal this bone defect or osteogenesis imperfecta. And in so doing, we could stabilize the spine with this intermedullary rodding surgery. Also, osteoporosis medications and bone marrow medication has been used in the osteogenesis treatment to help heal OI or osteogenesis imperfecta. In one particular case of adult treatment, we use the drug tiroparatide, which is a human parathyroid hormone drug, which is a growth hormone. But we know that not all patients respond to this human parathyroid hormone or growth hormone, so that this is limited in its application, the tiroparatide. However, when it does have its positive effect, we see that the positive effect in this aerial bone mineral density, it does have a positive effect, reducing pain and also help to heal the effect of this OI or osteogenesis imperfecta. As we move back now to the AMZ5X12MIPCA or the amazing 5x12 matrix in its implicit pharmaceutical configuration mode. Suppose then that we say this biphosphonate now is BPP, biphosphonate. Or let's say now that if we had used not this one but the case, let me just draw a little box here of the palmidronate, that would be like P, and let's say ME. Or PDT. And let's say now that we use now 250 milligrams for 2 months, and then we have abstinent for another 2 months, and this is going on for a year as the dosage regime. So this would be in the pharmaceutical configuration mode now. PME for the palmidronate, or if you use BPP as a biphosphonate, and we have 250 there, and we could establish now for now by inspection, but we already know it's 250 here in this case. But like I said, it's implicit because I have not revealed much about this pharmaceutical configuration mode in the application, in prescription, and in precision prescription in particular. We could differentiate the PDT 250 from say 4912530, and where the decimal point would have been right there, that would have been PDT or the palmidronate. This would be the titration, mass titration. As you know, if we have a tablet, it's 250 milligrams, then in precision, according to the mass spectrometer or the machine to measure the mass, the sensitivity, then you'll find that though we have 250, it could be 249.9999 and so on and so forth. However, the pharmaceutical configuration 5x12 or 1x12 would sort of outline the precision in this, which would not necessarily be shown of its relevance until we reach toxicology, whereby a very, very minute amount of certain substances would poison the body. But in this case, a 0.001 multiplied by 10 to the 8 minus 8 would not really do much damage. So this only applies for a case of where very, very minute amount would cause the body to be toxic and cause detrimental effect. So that's just a very brief sort of view on the implicit pharmaceutical configuration mode for our maiden 5-12 matrix. And here we just showing it, briefly as 250 milligrams. BPP stands in here for the bisphosphonate, or the PMD for the palmidronate. That's just, like I said, a very implicit sort of a thing. We'll not expand on it more for intellectual property and security purposes for the moment. So we have just briefly outlined now the treatment for this OI, osteogenesis imperfecta, and we'll take a break, and next week we will return with some other chosen topic in medical abnormality and your diagnosis, treatments, and application in our next video casting.